So arthritis, like arthro, it understands to be the joint, and itis, as you know, it means an inflammation. So basically, the best definition to define rheumatoid arthritis is it is an autoimmune that is affecting its own antibodies, and it is an inflammatory disease of joints. It's a very simple definition. So arthritis, it can affect any age group, any person, okay, and it can affect babies and children as well, the people in the prime of their lives. Okay. So I would like to know in my comment section, like, how do you see how what kind of patient you get in your, if you are working, or you must have seen they complain of, what are the most chief complaints you get to know when a patient visits you and tell you, and you have this thought in your mind that a patient can be suffering from an arthritis thing. Just put up with your answers in the chat box.
So I request all the attendees to post all your answers in the chat box or Q&A session. This will keep the session very interactive.
So my question is like, what is the presentation of a patient that comes to you that you suspect a patient can be suffering from an arthritis thing? Anyone? Come on. The slide is open in front of you. Only you can just look into this and answer it. Anyone?
Sir, if possible, we'll keep the questions to the end of the session.
Okay, sure. So going forward, so as I told, it is an autoimmune disease, and it infects mostly the joints, the tendons, the bones, which causes its inflammation, and ultimately that there can be a destruction of a tissue. Okay, so mainly it is commonest inflammatory joint disease that you can see currently. Yeah. So Ratnesh have answered it. Pain in more than 3 joints, especially major joints. Yes, good. So I want this session to be interactive. It will it will be good. So next, it affects approximately 1% of the total population. Okay. So what do you see in this patient presenting? Like there is a persistent inflammatory synovitis. So as I told, itis, that is inflammation, and synovial joint, that it signifies, which can cause to the cartilage damage and then cause bone erosions along with deformity and disability. So basically, to understand any disease, any pathology, we need to understand the anatomy of the thing. So what do you see here? You see here a cut section of a normal knee joint and a cut section of knee joint that has been affected. So significantly, just note the significant points for the exam point of view. You see the cartilage part. See you can see there is pitted cartilage in the second image. So what do you understand by a pitted cartilage? Anyone? So basically, like pitted, that understand, it's like there is a degeneration kind of a cartilage. There is a synovial membrane. You can see a patella, femur. So like in this case, my voice is audible, right?
Yes, sir. Yes, sir. It's audible.
Yeah. So you can see, as I told, there is synovitis. Okay. So in the second diagram, there is clear picture you can see of, there is an inflamed synovial membrane. That the red part you can see here. So patient will present you with the severe joint pains, the most common presentation, like mostly we see in old age people. But as I told, it can affect any of the age group. So what is the major functioning of this cartilages? As you all know that That's as a shock absorber, and mainly the frictionless movement. And synovial membrane, you see, it secretes synovial fluid, and it's also it causes the nourishment of the cartilage. So this is basically difference between a normal cartilage and you see the affected bone, especially this is of the knee joint. So overview, as I told, age, any age it can happen, and it happens mostly in 3rd to 6th decade. Female to male ratio is 3:1. You have to remember that. And pattern of joint involvement, it can be polyarticular, oligoarticular, and monoarticular. Anyone can tell what is oligo, poly, and mono? What is polyarticular? Polyarticular here, what is, does it would you understand that? Yeah, many joints is polyarticular. Basically, we say it involves 2 to 4 joints. Okay. Over 5, we can say it is involved for but more than 5, it is polyarticular, and oligoarticular. Okay, 1 mono. Oligoarticular means 1 joint. Okay. Basically, articular, what we say, oligo means there is an inflammation or there is a kind of autoimmune illness. What we say is mono means 1. So what does a patient, as I told, can affect any age. The main part you remember is female to male ratio 3:1, and patient mainly complains of morning joints stiffness, which persists for more than 1 hour. Okay, and it eases with the physical activity. That is its characteristic. Okay, just keep in mind that patient will come, the patient will explain you there is a stiffness of joints when I get up, and it persists for a few time, and then when there is a work, then it goes to work, the pain is relieved. Okay, and the typical joints that are involved are small joints, basically of hand and feet. Okay, so which joints of hand do you expect what are affected with this arthritis thing? Anyone in the chat box? Which joints of the hand? Name a few. At least one you should tell. Joints of hand. Yeah, good. PIP joints, yes. What else? Metacarpophalangeal, nice. Okay. As I told, this smaller joints. Tell me name of small joint of foot. One joint of foot. Small joint to name. Metacarpo for the hand, interphalangeal, yes, and also MP, that is metatarsophalangeal joints too. Okay, going to the next, the clinical manifestations, how the patient is presented. There are 2 types, articular and extra articular. Okay, so what do you understand by articular and extra articular? Articular joints, that we say, the manifestations, as you can see, the pain and swelling is affecting joint aggravated by movement is the most common symptom you see. The morning stiffness, you have to remember more than 1 hour, it is persistent, and joints involved, you can see in the picture. all the small joints of hand, foot, elbows, you can see. So joint involvement, the percentage of joint involvement, which like the patient says you that there is a pain in the site. What are the most common sites you see? 90% you see for the MCP and PIP joints of hand and MTP of feet. Okay, PIP you understand, right? Proximal interphalangeal, metacarpophalangeal, and MTP metatarsal. 80% patient complain for pain in knees, ankles, and wrist. Okay, 60 is for the shoulders, elbow, 50, and the acromioclavicular and TM joints, temporomandibular, it is the least 30%. So you keep in mind how the patient will be presented, what is the ratio, and how what sites are affected the most for the patients in such cases. Okay.